appreciate it. We apologize for the short notice. As it said in the email, we have Dr. Mayo. You know who Dr. Mayo is. And I'd like to introduce Colleen Rose, who's the VP of Operations for Long-Term Care. And I have their names in the email. And I'm going to let Dr. Mayo start and give you kind of an opening statement, and then we'll open it up for questions, and we'll do the normal round robin, one question, one follow-up, and I'll call on you guys. You guys are old hats at that. So with that, I'll let Dr. Mayo start.
Thank you. Thank you for joining me today. It's always great to partner with our media leaders and with our community partners and the public. And we've all been depending on one another for a lot of months through this pandemic, and we will continue to depend on one another to work through this. So I'm glad to be joined by Colleen Rose, my partner from Extended Care. She's one of our terrific leaders, and she's been such a competent contributor to managing the COVID pandemic. So I'd like to first set the context and remind everyone about where we are in the pandemic. As we all know, it's been 14 long months, if not longer, in our region. We've been through a lot together, many things. But in spite of that, the collaboration and the work of this community coming together has made a huge difference in our pandemic response, which has been exemplary. So right now, across the community, the level of COVID-19 is similar to what it was just under a year ago in April and May of last year. So we still have a significant number of patients in our hospitals on ventilators, and in the community, a lot of positive test results. And so even though we are getting accustomed to the growing rate of vaccination in the community and things opening up, it's an important reminder for the community that the pandemic and this infection remains very palpable in its impact on patients and on our loved ones and our healthcare systems. With that context in mind, we want to share that in Wayne County, DeMay Living Center Nursing Home, and in Ontario County, Clifton Springs Nursing Home have both had outbreaks of COVID-19. These outbreaks were identified not by symptoms, but by the routine and consistent surveillance testing that we are performing on our employees and on residents if needed. And this surveillance testing this past week has identified a total of 27 residents who are positive for COVID-19. Of those 27 residents, 24 of them have been previously vaccinated. And those who have been previously vaccinated remain asymptomatic. And that's a really important point, that even though we believe they have a new level of infection, they remain asymptomatic. One of the 3 who was not vaccinated has been hospitalized. We have followed all of the state requirements for notifying resident family members, as well as reporting to the departments of health and the state. But we felt it was important to share this in a proactive and transparent way with the public, and take this opportunity to remind everyone that the pandemic is still persisting, and it is really important to be vaccinated, and that the vaccine is actually working, that among these vulnerable nursing home patients, that they are benefiting significantly by having been vaccinated and by the care that they are receiving in those facilities. So I'll stop there, and Colleen and I will be glad to take any questions.
Let's start with Jennifer.
Okay, if I could, Dr. Mayo, can you break down, are all of the cases, those numbers you provided are across both nursing homes? Or can you break that down one more time for me on the numbers and where those folks were living at the time?
Sure. There are 10 patients at the Clifton Springs Nursing Home and 17 at the DeMay Living Center.
And all of them had been vaccinated?
All but 3.
All but 3. Okay. And the only one hospitalized is one who had not.
That's correct.
Can you, do you have any information about how you believe the COVID sort of got in and started spreading there? Do you have any information about how many employees in those facilities are vaccinated?
Yes, tracking the person-to-person spread of these infections is nigh to impossible, but we do follow the state guidelines of testing all of our employees twice a week. So we don't know if it was an employee or a visitor. That really is less important to me because of how difficult it is to sort that out. But what is most important is the message that vaccination matters. And we are continuing to encourage our employees to be vaccinated, our residents to be vaccinated, and the entire public to be vaccinated. Because if you happen to get a breakthrough case of COVID, your symptoms will be vastly less severe than if you had not been vaccinated.
And sorry, I was just clarifying on that first question. So Veronica, this is my second question. Sorry. When it comes to visiting, obviously we know for a year, visitors were kept out of nursing homes. How does this impact visitation right now and moving forward? And what is your message to these families?
Colleen, would you like to take that?
Sure. So a new visitation guidance was released on March 25th, which helped the nursing home become less restrictive with visitation. When we do have a new outbreak at a nursing home, we restrict visitation and conduct outbreak testing. If one round of outbreak testing is conducted and no new cases present themselves, we can continue with indoor visitation, except for those with a positive COVID-19 diagnosis or if they're on transmission-based precautions. We do not restrict visitation for those at end of life and those who qualify for compassionate care visits.
What's your message to families, I think, is the other question she asked.
Sure. So we update families on a regular basis. We're required to update them within 24 hours of a new case in staff or residents. And we also go above and beyond and update our families weekly through email, which does alert them to what the visitation restrictions are. And we do have families who read the email and call us and ask for clarification, and we do support that communication as well.
How long does it normally take you to do that testing you talked about, outbreak testing? Like, how long would a family be ineligible to visit for while you're doing that?
We test every 3 to 7 days based on the previous testing results, but we update within 24 hours of those results.
Tyler?
Yes, hi. My question is the 3 that residents that you mentioned were unvaccinated and ended up getting COVID. You mentioned only 1 was in the hospital so far, correct? How are those other 2 doing?
They're doing well. One has a mild cough and the other one remains asymptomatic.
Okay. And I also wanted to ask Dr. Mayo, because obviously you mentioned you guys are recommending that everybody get vaccinated, including the employees and the staff. That Pfizer is hoping to get full approval through the FDA. I mean, can you give us your thoughts on that? And is RRH considering, if that does get full authorization, to require all of its employees and residents to get vaccinated?
Yes, that's a great question. There's a lot of interest around the next recommendations that will come from the FDA as well as from the state at this level of review. And Rochester Regional Health will be looking at that carefully. We are already thinking about what our next steps would be and what we will do. We don't have any decisions yet on this, but we will be certainly partnering with our regional partners as well in these kinds of decisions.
And how big of a deal would full authorization be for private entities and for herd immunity in general?
Well, I think full authorization will bring I don't really want to call it a final seal, but another level of approval that means that the experience with the vaccine now in the hundreds of millions of vaccinated individuals is so significant that the FDA is willing to say that they stand behind all of their recommendations, that the data is solid, that it is safe for the public. And so I think that will provide some additional reassurance to individuals who may be still feeling some hesitancy about receiving the vaccine.
Okay. Randy?
It's Dr. Mayo. How are you, sir?
Hi, Randy.
Great. Hey, quick question, just from a medical standpoint. I don't know if you refer this to as one of those breakthrough situations where you had a couple of dozen patients who were nursing home residents who tested positive even though they were vaccinated. Does that have anything to do with the fact that they may be somewhat immune compromised because of their age or underlying conditions? I mean, is that really what led to all those folks, testing positive, or could that happen in the general population in that kind of percentage?
That's a very reasonable question and rationale. So I don't have a clear answer for that, but I think that there's good logic to that. And one of the things we don't know yet from a scientific standpoint is how do we know if someone with asymptomatic disease is newly infected or shedding viral particles from a previous infection? The testing is not able to sort that out, the difference between that out, and so we don't know exactly.
Okay, thank you.
Lowell?
Yes, Dr. Mayo, I have two questions, but I know you said the May nursing home. What was the first one that you mentioned there?
Oh, yes, the Clifton Springs Nursing Home and the DeMay Living Center.
Okay. All right. So my question is, do we know if this was a new variant of COVID-19? And also, what was the percentage of staff and residents that were vaccinated in both of those nursing homes?
Yes, we don't know yet if this was a variant that requires additional special testing that is sent out to specialized laboratory. We have been sending samples and pilot, samples for that kind of testing. So we will be looking at that, but that will take some time to get the final answers on that. From a clinical perspective, however, it's not behaving differently than the current COVID-19 virus that we're familiar with. So from a vaccination standpoint, right now, our nursing home, those nursing homes are running a vaccination rate of employees between 35 and 45%. So we continue to work with those teams and provide education and work through any hesitancy issues that may be causing them to decline at this time. Our resident vaccination rate is between 80 and 90%. So residents have been vaccinated as well as staff who are willing, and we continue to work with all of them to improve vaccination rates.
And will you have any, I know you said you released new visitation policies a few weeks ago. Does this change anything at the homes for the residents and the staff? Will you temporarily pause visitation or anything?
I'll take that, Rob. Yes, for Clifton and May, both facilities are on pause because they're continuing their outbreak testing and investigations. So once again, end of life visits and compassionate care visits do continue per the state requirements and regulations.
Thank you.
Can I jump in with another one?
No, I'm just kidding. I guess so. Go ahead.
I guess Dr. Mayo and Colleen, I was surprised to hear those percentages for the employee vaccination rates. I can sort of hear folks at home or family members saying, you know, why do I have to be locked out of the nursing home to visit my loved one if I'm vaccinated and they're vaccinated, when the employee rates are just 30 to 35%? Is that what you're averaging across long-term care right now, or are these two particularly low for some reason?
35 to 40%. Yeah. So, well, it's also important to remember that long-term care employees are tested twice a week. The general public is not tested at that rate. And long-term care employees wear personal protective equipment, masks, face shields, gloves, and so forth, you know, all day. So there is a difference there. And so I want to remind the public of that. But these rates are not unusual across the state in some of the long-term care facilities. And so we're continuing to work with our team to accelerate acceptance of the vaccine. Colleen, any other thoughts?
I think you said it well, Rob. Thank you.
Okay, anyone else who didn't get to ask a question need to ask a question? I don't think so, but want to make sure. Okay, thank you guys for joining us on such short notice. Have a good weekend and stay safe.
Thank you
Thank
so much.
you.